Bismillah ar-Rahman ar-Rahim. Myself Dr. Bashir, laparoscopic surgeon. Today we are having a case of 45 years old female having multiple history of multiple fibroids. She is having history of heavy menstrual bleed and one cesarean 5 years ago. Today we are going to perform total laparoscopic hysterectomy, and you can appreciate that there are a lot of adhesions intra-abdominally. First of all, I have inserted one umbilical port for the camera and one port for the working port. And before going to start the procedure, myself, Dr. Bashir, Mr. Muzammal, my camera assistant, Mr. Sajid, my assistant, and we have one staff, and Mr. Shoaib, our anesthesia assistant. So in this case, we are going to demonstrate how to perform total laparoscopic hysterectomy in a very simple way. So before going to start, I'm going to adenolize this momentum by using the first triad machine, LigaSure. Show me. If your LigaSure is not showing problem, you can wash it with the normal saline. तो इससे इसकी जो है coagulation and sealing बेहतर हो जाती है. Cannula दें. It's having some problem, Muzammil. Should we replace it? It's not working properly. दूसरा वाला उठा के देंगे. तो आपने इंसर्ट करना है और अपर लिप एंड लोअर लिप दोनों सर्विक्स के ओपन करके आपने इसको इंसर्ट करना है. देन यू हैव टू पुश दिस रॉड and it will pierce the endometrium of the uterus, and then you have to fix over it. After that, you have to apply this cup. There are 3 sizes of the cup, and I mostly use the medium size. You have to apply like this, and it will cover over the cervix, and you have to fix like this. And then where you attain the proper exposure and traction, you have to fix from here. And then to fix this rod, use this to fix the rod like this. And now you can rotate uterus upward, downward, right lateral, left lateral, and it's very important in performing the laparoscopic hysterectomy. Thank you. Next one. Working. Sometimes if the bite is not proper, then LigaSure may cause some troublesome. तो आपने जब भी LigaSure यूज करते हैं तो आपने जाम में उसकी bite and the tissue should be proper. So here you can appreciate a uterus with multiple fibroids, 1, 2, 3 anterior fibroids. So it's time to use the colpotomizer. Patient पीछे खींचो बेटा, wait करेंगे. So you can appreciate that here is the uterus with multiple fibroids and the left-sided ovarian cyst attached to the ovary. Okay, and दूसरी side पे from second side, that next side is normal. ठीक है? And there is some small size cyst over here as well. So now we are going to start the dissection, and one person is actually giving the traction from the vagina, and that is called the ovarian ligament. Sorry, it's a fallopian tube. Here is a ovarian, and it should be 2 centimeters away from the uterus. You can, and we are going to start dissection. And fallopian tube 3 centimeter away from the uterus. And the round ligament is 4 centimeter away from the uterus. सारी पुश करें आगे. Yeah. Okay. So come from this side. So same formula, 2 centimeter away from the uterus is ovarian ligament. Assistant who is actually on the colpotomizer, he or she should be very expert. अगर आपका colpotomizer अच्छे से फिक्स नहीं हुआ तो आप बहुत सारे प्रॉब्लम्स का शिकार हो सकते हैं ड्यूरिंग सर्जरी. If you are not maintaining the distance from the uterus, you may encounter with the passive bleed from the uterus. So 3 centimeter away from the uterus is the fallopian tube. Little bit ooze होता है, no need to worry. So we are on the left side and the round ligament 4 centimeter away. We are having bleeder here. So we have a plan to do the bilateral salpingo-oophorectomy. So we are not actually taking so much serious of this bleeder, about this bleeder. So round ligament done. And still you have having a blood from uterus अगर आप rule follow नहीं करेंगे. The basic purpose of doing making such videos is that normally in over circumstances things. Yeah, next hook दें. We are going to separate the urine bladder. The balloon here, there is a balloon of urine bladder, and it's all the urine bladder. Because due to previous cesareans, she is having bad attachments. So I'm going to actually. So you should be very careful, avoid to injury to the bladder. Using the hook, and by using the hook, we will go slowly, little bit by bit. साजिद आगे पुश करें, पुश करना यार. हाँ
پراپرٹی ٹیکس ہونا نا وہ تو ہے وہ تو تجھے اگلے سال دے ہوگا نا ہونا لگ اسٹارٹ رہی ہے ہاں یا کوئی اور بھی چل لے سال بعد دینا
So, بیٹا فل کریں بلیڈر, fill the bladder please. بیٹا اٹھائیں اس سائڈ پہ کریں. So we are having issues here. And our anesthetists were so active on the mobile phone, so you can enjoy the talk about the government taxes. And mostly I want that the people should learn from the general issues, general problems in our setups, in our theaters, and it is one of them. So come to the point, and actually my another assistant is filling the bladder dye test, Mr. Mubashir. Okay, give me the ray band. Now we are going to do the blunt dissection for the separation of bladder, and you can appreciate the landmark of uni bladder easily. Camera saaf karo beta. Very gentle. I am enrolling the gauze piece and will gently push the. इनको भी पोर्ट से मिस्टर मुजम्मिल गिविंग मी अ टिप दैट कि सर बाद में इन्होंने मिलना नहीं है, तो छोटे पीसेस इनको अभी निकाल लें. तो आप अपने असिस्टेंट की टिप को जो है ना हमेशा यूटिलाइज करें कि बाद में आपको इनको निकालते हुए दिक्कत होगी. हाँ जी, हाँ ओके, गोइंग बैक. लिटिल बिट पीसेस हैं. अच्छा, एंड so, ये इसको साथ ले लेंगे. ये भी आ जाए. और CPU showing. चल, so bladder separated, uterine done. Now it's time to go for the salpingo-oophorectomy. So I always try to do at the end, because के अगर आप स्टार्ट से करें तो थोड़ा सा आपको टाइम ज़्यादा लगता है. और I think so we are having a bleeder here. तो एंड पे आपको बड़ा इजी हो जाता है करना. assistant as well. ہمارے ایک اسسٹنٹ کا ایک بڑا مشہور جملہ ہوتا ہے، ہمیشہ آگے کہتا ہے سر یہ نسلی کیس ہے، تو یہ نسلی ہسٹریکٹمی ہم کر رہے ہیں. وی آر ہیونگ اے لاٹ آف difficulties. It's not an ideal case for the beginners. We have done alhamdulillah more than 100 cases, so we are alhamdulillah confident doing such kind of procedures. Ideally the recommended cases are where the fibroid is less than 5 centimeter and patient is having all NVDs, and before surgery you should advise clean enema, gut should be empty. So these are the ideal cases, but sometimes every case is not a simple case. You should be prepared and you should be able to do all kind of cases. Yes. So the signs of good uterine ligation is that your uterus is turning blue. Okay. Initially it was pink. So we are going to start anterior colportomy. So you can appreciate the upper edge of our cup, colportomizer cup. So it's your landmark. You should have a very good control of your hook, utilization of the hook. A little bit slippage of the hook may lead to the gut injury. اچھا اب یہاں پہ آپ کو فوگ اکٹھی ہوگی. یو کین اوپن اے وال اینڈ آپ فوگ کو ریموو کر سکتے ہیں. چلیں 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 نیکسٹ ساجد بیٹا. Here is the vaginal flow. آگے پش کرنا یار. ٹھیک ہے دیکھ لیں گے یار. ٹھیک ہے ٹھیک ہے. تو آپ کے جو موسٹلی اسسٹنٹ ہوتے ہیں دے نیور نو کہ ان وٹ سچویشن یو آر ہیئر اینڈ دے آر ہیونگ سم تھنگ ان دیئر مائنڈ. تو ان کے لیے یہ امپورٹنٹ نہیں ہے کہ وٹ کائنڈ آف سرجری وٹ کائنڈ آف اسٹریس یو آر ایکچولی فیسنگ. اینڈ ہی واز ان ہری. سر ٹیل می اباؤٹ دس کائنڈ آف الٹراساؤنڈ. So here there could be some vessels. So precautionary, I was actually coagulating this area.
Light off. दूसरी light off.
Still I am having some feeling that we should coagulate this area. Anticipation and precise movement is very necessary in such kind of procedures. سو اگین لینڈ مارک آپ کو وہی ہے کلپٹمائزر. آپ اس کے فالو دا اپر لپ, دس اپر لپ, اوکے, ہیئر اینڈ سرکمفرنشلی آپ آتے تھے. So we are doing the posterior part, damaging the guts, controlled movement along the upper border of the cup, and come from the other side, from here. تھوڑا سا دکھا دیں, چلیں. اوہو, yes, it's separated all around. Done almost up till now. Let me brief you. Initial adenolysis due to previous surgeries, then right and left pedicles, then uterine, and then separation of the bladder, and then anterior colpotomy, posterior colpotomy, and then salpingo-oophorectomy. Now it's time to deliver the uterus. So it's a bulky uterus, and it will take time to deliver this uterus, such kind of uterus. So I will take the assist of my mecmil screw, which is used in the open surgery, and I will fix with at one fibroid and will pull slowly. And then later on I will close this vault through the vagina with vehicle number 1 in 2 layers. And after that we will show you the video. So it's the final look after the total laparoscopic hysterectomy. Bladder fill kare beta, theek hai, and so we repair the vault from the vagina with vehicle number 1, and here you can appreciate the unibladder. So it was far away from the vault area. Hemostasis cured, no need to place a drain, and inshallah this patient will be mobilized after 4 to 6 hours and will be discharged within 24 hours. So yeah, that's simple. I'm very thankful to हमारे जो anesthetist हैं, the chief consultant anesthetist Dr. Ilyas sir, and so it was a total laparoscopic hysterectomy with bilateral salpingo-oophorectomy, and she was having multiple fibroids and bilateral ovarian cysts. So we have done TLH plus BSO, and in comparison with the open TAH, the pain is very less. Patient is very active within 24 hours. No problems of wound infections and daily dressings, and very less likely injury to the unibladder. So these are the basic benefits of the laparoscopic hysterectomy, and definitely we have to do this surgery in under general anesthesia. So she was having some kind of backache, so it was the patient desire. So I'm very thankful to my whole team and my sir, anesthetist, and thank you so much. Please watch and subscribe. Whole specimen, ovaries and the uterus with the multiple fibroids.